Is everything going smoothly in your bowel, or is there a problem? We're going to discuss the 7 warning signs of colorectal cancer today, and why it's critical that you get more knowledgeable about this kind of tumor since it's the second most deadly and third most common disease. This tumor records for around 10% of cancer-related fatalities. So pay attention. This video will be divided into 2 halves by me. The first section discusses the signs and symptoms of colon cancer, those that indicate a problem but are not immediately apparent. And in the second section, which is the most crucial, in my opinion, I'm going to talk about prevention, including the steps you can take to lower your risk, and the foods you should eat to ward against this illness. This is going to be a pretty long video, so stick around until the end and tell me if you know anybody who has had colon cancer and which country they are from. I'll also be talking about polyps and why colon cancer is becoming more common in younger individuals under the age of 50. Now, let's see what the 7 warning signs are that might indicate a problem with your bowel movements. First, symptoms. Changes in bowel habits. Understanding your bowel patterns is crucial. Some individuals use the restroom immediately after breakfast, while others use it twice or 3 times a day, and still others only use it once or twice a week. What is your typical bowel pattern? If you notice any variations in your regularity, pay note as these are normal bowel movements. To be sure, 65% of individuals with colon cancer have some changes in their bowel habits. However, these changes can vary from person to person and depend on the location, size, and stage of the tumor. The feces may change color or substance, and they may start going to the toilet more frequently, or in some cases, much less frequently. Be cautious, though. If these changes persist or worsen, you should consult a doctor. The primary alteration is that the individual begins experiencing increased diarrhea that is unrelated to the viral illness, continues for several days, then gets constipated before experiencing more diarrhea. Once more, be mindful of any significant shift in bowel patterns. The second symptom is blood in the stool. Because the large intestine is separated into multiple sections, it is crucial to monitor your feces and not flush them out immediately away if you see any blood. The right side of the colon is unique in that it is bigger than the other 2. The ascending, transverse, descending, and sigmoid colons are followed by the rectum and anus. Additionally, because the colon's job is to absorb the water, coupled with waste, its stools are liquid. For this reason, if the tumor is on the right side of the ascending colon, there normally aren't any symptoms that indicate the tumor is obstructing the colon. The left side of the colon has smaller descending and sigmoid colons and better formed feces. It may bleed more due to anemia, or your stools may turn black like tar and smell awful. There may also be bright blood that drips into the toilet after a bowel movement or even after you wipe it up with toilet paper. Of course, other factors like hemorrhoids, anal fish, or even eating beets and making your feces red can also cause this, but it's crucial to make sure it's nothing serious. You shouldn't assume that bleeding is simply a result of hemorrhoids, because bleeding can occur in a variety of degrees, from little amounts to major bleeding. Additionally, bleeding might occur because the tumor has ulcerated a blood artery that supplies the tumor, which has caused a wound in your colon. Alternatively, you may have bled because you applied so much pressure to the intestinal wall when you squeezed. Again, this has to be looked into. Blood in the stool. Consult your doctor, even though it doesn't always imply you have colon cancer. Third symptom, soreness in the abdomen. Seek attention if you've never experienced stomach discomfort before, and you're suddenly having severe cramps that come and go, or even pain during defecation, which occurs when the tumor affects a portion of the rectum. It might be excess gas. See a doctor if your discomfort doesn't go away, even if you may have altered your diet or are eating a lot of fiber, since it might be a sign of colon cancer. The fourth symptom is exhaustion and fatigue. It's a longer-lasting exhaustion than the kind you get from poor sleep. In cases of colon cancer, this weariness may occur 2 weeks out of every month. As I mentioned before, the tumor may be bleeding slowly, causing you to become anemic. You have iron primate anemia and consume a healthy diet. You should screen for colon cancer, which is one of the primary causes of anemia without an evident reason. Don't ignore this symptom since cancer cells need to proliferate fast, which uses a lot of energy and depletes your nutrition. These factors can lead to exhaustion and persistent weariness. Fifth symptom, bloating. A tumor that is partially or totally obstructed in the gut can generate a buildup of gas and feces in addition to the tumor. This is one reason why abdominal bloating or swelling can be a typical symptom of colon cancer. It's recommended to not ignore it as it may obstruct the passage of food and liquids, which can also result in bloating and excess gas that can produce colic-like stomach pain. Abdominal discomfort and bloating can be caused by a variety of factors, but if you have unusual or regular bloating, it's recommended to consult a doctor. Symptom number 6, loss of weight without cause. Now, if you've lost weight while following a diet, that's normal. What I'm talking about is unexplained weight loss. You used to weigh 70 kilograms, but now you only weigh 65 or 63, and there hasn't been any change in your diet, your level of depression, or your level of exercise. There are several reasons why colorectal cancer might cause weight loss. One is that the tumor can change a person's capacity to absorb nutrients and calories, similar to a worm that eats everything in its path. However, the tumor can also create certain cytokines, such TNF-alpha interleukin 1 and 6, which can reduce appetite and cause weight loss. Our final and most significant symptom is nausea and vomiting, which might be caused by the tumor obstructing intestinal passage. The tumor may also raise the body's energy expenditure, leading you to lose fat as well as muscle. Symptom number 7. Having the impression that your bowels haven't entirely emptied. This is known as tenesmus, but before you do, click the like button on the video. YouTube will share it more widely to those who lack access to medical facilities. Don't be afraid to share the video with your friends and family. With their support, many lives can be saved. Tenesmus experiences the uncomfortable sensation of incomplete evacuation even after having a full bowel movement because after using the restroom, you feel like something is stuck in there and not everything comes out, forcing you to use the restroom again. This sensation of incomplete evacuation, even when there is nothing left in the colon to evacuate, is a typical sign of colon cancer because the tumor may partially or totally clog the intestine, giving the impression that there is stool there that is really the tumor. When this occurs, the feces may change shape, becoming thinner and appearing ribbon-like because it travels through the center of the tumor. It's essential to note, though, that many colon cancer patients do not show any symptoms when the disease is first detected. Therefore, it's okay if you don't have any symptoms, but you should be aware of the risk factors and decide whether to get screened for colorectal cancer to check for polyps. Definition of colorectal polyps: certain polyps that line the mucosa, the lining of the colon, can turn into colorectal polyps when they mutate. This is how colorectal cancer is formed. The majority of polyps do not develop into cancer, but some do over time. It typically takes 10 years for a polyp to develop into cancer. What are the risk factors for colon cancer and why, like most diseases, is it rising in younger individuals if left untreated? Bowel cancer is caused by several causes. First, as we age, our defenses weaken. A variable polyp with a weak immune system has the potential to develop into cancer. Secondly, inflammatory bowel diseases like Crohn's disease or rectocolitis can develop. Thirdly, genetic disorders such as Lynch syndrome, which carries a high risk of colorectal cancer, or familial adenomatous polyposis, enhance the risk and account for 1 in 5 cases of colorectal cancer, which is a multi-stage illness that also increases the importance risk of colorectal cancer. I would also emphasize a family history of colorectal cancer, whether it be from a parent, brother, or other close relative. If you have a family history of colorectal cancer, you should be concerned. Lastly, taller people have a higher risk of colon cancer. These are risk factors that you cannot change, but smoking is one that you can. Smoking not only causes a rise in lung cancer but also in stomach, colon, bladder, and many other types of cancer. Alcohol also raises the possibility of colon cancer. Living a sedentary lifestyle means that we must exercise and consume meals low in fruits and vegetables and low in fiber, particularly ultra-processed foods that are rich in chemicals and low in fiber. While these foods may enhance shelf life, they will also negatively impact your health. A diet heavy in processed meats, like bacon, sausage, mortadella, turkey, and salami, everything that no one can possibly dislike. In addition, excessive consumption of red meat and saturated fat is contributing to the significant rise in colon cancer cases among younger adults. As a result, the American Society for Preventive Medicine has lowered the recommended age for colonoscopies in individuals at intermediate risk from 55 to 45. Simply put, it's because they're eating too much industrialized food, not enough whole foods. Too many sedentary persons had an increase in overweight and obesity, and so on. Here are 7 tips to help prevent colon cancer, the last one being the most crucial, so make sure you read through to the end. First tip. Drink lots of liquids, especially water, as this helps your bowels function better and prevent constipation by minimizing the amount of time that toxins and feces come into contact with your colon's lining. Second tip. Consume a lot of fruits and vegetables because they are high in antioxidants and fiber. In addition to improving intestinal flora and speeding up the stool like water does, fiber also lowers the amount of red meat you eat. Yes, you can eat some, but avoid excess, especially processed meats which are high in sodium. Tip number 3. Consume foods and spices like cinnamon and turmeric, which are naturally anti-inflammatory. Tip number 4. Consume dairy products and milk. Well, but isn't milk inflammatory? Well, the most recent research indicates that milk does not cause inflammation. In fact, milk from yogurt, cottage cheese, and cheese has been shown to protect against colon cancer. Of course, it's best to avoid milk if you have a lactose intolerance or are allergic to milk protein, but milk does, in general, prevent colon cancer. Tip number 5. Get moving and avoid sitting still. Exercise helps your intestines and balances your hormones. Insulin and estrogen lower inflammation in the body, help you maintain a healthy weight, lower stress levels, and all of these things contribute to the prevention of cancer. Tip number 6. Avoid alcohol and smoking. Tip number 7. The most crucial thing to do is to get your body checkup. At the absolute least, have your stool tested for occult blood. If you're over 45 and at intermediate risk, a colonoscopy may be more interesting. You can detect blood traces in your stool that are invisible to the human eye. Again, a colonoscopy is a crucial test because it can detect polyps before they develop into cancer. The purpose of this is not to scare people, but to raise awareness of the high cost-effectiveness of colonoscopies. Wealthy nations that follow strict guidelines lower the age at which a person must have their first colonoscopy because early detection of cervical cancer increases the likelihood of a successful course of treatment, full recovery, and cure. Please help to share, subscribe, and hit the notification bell, so more people have this knowledge and get updated with our latest video. Thank you! And take care of your body health and stay healthy. See you in the next video.